Why is the critical period crucial for amblyopia treatment? Imagine your brain as a sponge that soaks up visual information most easily during a certain time in early childhood. That time is known as the critical period, and it plays a vital role in treating amblyopia, often called lazy. During this window, the brain's visual pathways are highly flexible and capable of change. This means that if a child's vision isn't developing properly because of misaligned eyes, unequal refractive errors, or visual deprivation like a congenital cataracts, early treatment can make a big difference. The reason is that during this critical period, the brain's visual cortex is especially receptive to new input. If the problem is corrected during this time, the brain can reorganize and strengthen the connections related to the weaker or affected. This plasticity allows for significant improvement in vision, sometimes even restoring normal sight. But once this window closes, the brain's ability to adapt diminishes sharply, making treatment less effective. It's like trying to reshape wet clay versus hardened clay. The earlier you work on it, the easier it is to mold. Research shows that the earlier treatment begins, the better the outcome. For example, if a child with a congenital cataracts receives treatment before about 4 months of age, they are more likely to regain good vision than if treatment starts later. This highlights how narrow and critical this early period is for some types of amblyopia. During the critical period, key visual skills such as sharpness of vision and depth perception develop rapidly. If amblyopia is not addressed before these skills are fully formed, some may never develop properly. For instance, stereopsis, which helps us perceive depth, usually develops within the first 2 years of life. If not treated during this time, a child might miss out on full depth perception, which can affect everyday activities like judging distances or playing sports. At the brain level, amblyopia occurs because abnormal visual input weakens the connections in the brain's visual cortex. When the input from one eye is blurry or misaligned, the brain suppresses that input to avoid confusion, leading to reduced vision in that eye. During the critical period, this suppression and weakening of connections are still reversible. But after it ends, these changes become more permanent, making it harder to recover lost vision. This is why early diagnosis and prompt treatment are so important. Treatments like patching the stronger or using eye drops to encourage use of the weaker work best when started early. While treatment can still help older children and adults, the results are often less complete and may requiring longer or more intensive therapy. In summary, the critical period is a special window when the brain's visual system is most capable of change. Acting during this time maximizes the chances of restoring normal vision and binocular function. It's a reminder that early eye checkups and timely treatment can make a real difference in a child's visual future. Always consult with an eye care professional for personalized advice and care.